COVID-19 has impacted so many areas of our lives, and today we're focusing on how it's affecting women's heart health. I'm joined by Dr. Stephanie Saucier. She is the director of the Women's Heart Health Program at Hartford HealthCare. Thank you for being with us, Doctor.
Thank you so much for having me today.
How specifically has COVID-19 impacted women's heart health?
So COVID-19 has impacted women's heart health in the fact that most people are avoiding hospitals and doctors' offices in fear of contracting COVID. However, women really need to come in if they are having symptoms. Patients are missing, postponing special appointments, or even potentially urgent or emergent procedures due to the fear of COVID-19. But I just want to reiterate that, the hospital and the offices are really doing everything that we need to make sure that it's safe for our patients.
Absolutely. And really, it's important women take care of their hearts all the time, but especially now when there's so much stress going on.
Absolutely. So COVID has changed everyone's life in more ways than one. And women being the primary providers and caregivers to the family, your family really relies on you and they need you around. So it's important now more than ever to look for the risk factors and treat any symptoms you may have.
Well, a lot of women also enjoy maybe a night for some fun and wine, and you have an event called Pinot and Prevention. Tell us about that.
Yes, this is a virtual event this year focusing on heart disease in women. Every registrant will get an educational session with Dr. Swales and myself, and a comedic performance by Kelly McFarland, and they will all get a recipe upon registration. All they have to do is go online to hhchealth.org/Pinot and Prevention, and they can sit from the comfort of their homes with friends and family and learn some educational information about women's heart disease that may save their life one day.
And in our last few moments with you, 3 things you can do to be proactive to keep your heart healthy.
3 things to be proactive about keeping your heart healthy is maintaining a healthy diet and exercise, and to keep active during these times. Watching out for symptoms would really be the best thing that you can do.
And I know you said don't be afraid to go to the emergency department if you need to.
Don't be afraid. We're safe and we're taking all the precautions. So come to the emergency department if you need to. Go to your doctor's offices. We are a safe place.
Dr. Saucier, thank you for being with us.
Thank you for having me.